Hi, good morning Max. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Max William.
And what is your candidate number, please?
My candidate number is 232089227.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me what you feel your greatest skill as a nurse is.
I'm very proud of my ability to really listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard. My experience in the medical field, working directly with patients, has shown me just how far actively listening can go in helping make someone comfortable. During my time working in admissions in my last position, I learned that addressing patient concerns and making sure they felt we were genuinely listened to was just as important as receiving quality care.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working in a team, because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivation, and am equally comfortable working alone.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when you just can't do more. Seeing someone in pain, or feeling miserable, and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you ensure you remain up to date on advances in nursing?
I use several approaches to remain up to date. Along with continuing education courses, I subscribe to several industry publications to learn more about what's on the horizon. I also follow thought leaders on social media, giving me additional insights, and converse with my network regularly to find out about their discoveries.
How do you explain complex medical terms and procedures to patients who don't have a healthcare background?
Since patients have different levels of understanding regarding medical terminology, I use a combination approach when speaking to them. Usually, I'll lead off with a formal term and couple it with an informal term or description, depending on the situation. For example, I may tell a patient that a medication is used to treat hypertension, also known as high blood pressure. That introduces the phrases physicians may use when speaking with a patient, while using terms that feel familiar to ensure understanding.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role-play. Don't worry if I stop you when the time is up.
Mihiraa, based on my examination, I can confirm the presence of nappy or diaper rashes on your baby. Even though diaper rashes are severe cases, it is a very common condition among babies, which is not a cause for any concern. Let me provide the steps we can take in this situation. The utmost importance is the need for changing routines, which is causing these rashes. Along with that, we can discuss some ways to prevent rashes. Well, before proceeding, do you have any questions?
Nurse, I can't believe it's just a rash. Actually, my son has been crying much more than usual, and also he is having trouble sleeping. So, nurse, I think it must be something more serious.
Your thoughts are really natural. Mihiraa, I can explain the reasons for my clinical opinion.
Okay.
The first point to be considered is that nappy or diaper rash varies in severity. Probably, the intensity might have increased, which is why the baby showed discomfort and cried a lot.
Oh, I see.
Secondly, the rashes are just confined to your baby's buttocks, and not found in any other parts of his body. Finally, besides these rashes, he has no fever, or showed no other symptoms. If it is due to some other medical condition, other symptoms will be present. Thus, I conclude, rashes might be the cause. I hope your concerns are now cleared.
Yes, nurse, what you said is right. But for this reason, will a baby cry a lot?
Yes, Mihiraa, your doubt is reasonable. There are several reasons behind a baby's cry. Thing to remember is that it is common for young babies to cry. Moreover, as your baby is 10 months old, the possibility of teething can be a reason for his cry.
Yes, that is true.
Also, it can be colic, which is usually seen in healthy babies after 6 weeks, which goes away naturally, and is unlikely to be a concern. Mihiraa, I can reassure you that your baby's cry won't be because of any serious ailment, it can be due to any of these factors. What I suggest to you, at this stage, is to closely monitor your baby, and try to figure out the reason behind his cry.
Sure, nurse. I will monitor him closely as you suggest. Actually, I didn't realize nappy rash could be this severe. Anyway, I am glad it isn't something else more serious.
Yes, Mihiraa. By the way, may I know about your baby's diaper changing routine?
Sure, why not? I change the baby's diaper every few hours. And I am using disposable nappies.
All right. Can you tell me about the soap or baby wipes you use?
Actually, I use scented soap and baby wipes every time I change his nappies.
Okay. Have you tried any treatments for nappy rash?
Yes, I have tried over-the-counter antiseptic creams, which work temporarily and provide paracetamol for pain.
Thank you for your information, Mihiraa. I can provide some common strategies for preventing rash.
That will be of great help, nurse. You may please proceed.
All right. Let's discuss cleansing first.
Okay, sure.
Always gently cleanse his skin, as you are aware. Cleanliness is of utmost importance for the baby's well-being. It will also help to prevent rashes to an extent.
Yes, I will continue to do that.
Next, you can try the use of barrier creams, which is a formulation used as a cosmetic, to place a physical barrier between the skin and contaminants that may irritate the skin.
Okay, I will use them.
Okay. And Mihiraa, as you said, you use scented soaps and wipes for your baby. Kindly avoid perfumed soap and baby wipes. It is because perfumed products can cause allergies and other skin problems.
Oh really? I wasn't aware of this. Okay, I will use unscented cleansing agents.
In addition, I also recommend you make him spend a short period of time without the use of diapers. It gives some breathing time to the skin, which helps in keeping the skin healthy.
Okay, nurse. Thank you for your valuable information, and definitely, I will follow your suggestions.
Thank you for accepting my suggestions. Please feel free to contact us for further queries. I wish your son a speedy recovery.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.